Hello, friends and family. Have you ever heard of this term dry socket and you wondering what that is? What is dry socket? So that is what we're going to talk about today. You may have heard of a friend of yours that went to a dentist. They ended up having a tooth extracted, and a few days after, they're out there with a whole lot of pain, went to a dentist, and then they were told they had a dry socket. And so you're left wondering, what in the world is dry socket? That's what we're going to unpack today, okay? Before we talk about we'll talk about what it is, and then we're going to talk about ways to avoid having dry socket. 5 ways to avoid having a dry socket. Okay, so I'm Dr. Valerie Mukanga with Healing Wings Dental. Healing Wings Dental is the place where we help our patient maintain and or regain their oral health and their smile so that they can soar in life. So dry socket. Dry socket, what it is? A dry socket is a process by which, after having had a tooth extraction, the area where the tooth used to be or the socket is not healing properly. And because it's not healing properly, we're now calling that area or that factor or phenomenon a dry socket. What happens, in fact, when a tooth is extracted? When a tooth is extracted, now the healing process has to start in that particular area. And how does that happen? There's going to be a blood clot that's going to be formed in the socket to ensure that everything is covered, right? That the bone is covered, that the nerve ending in that particular area are covered. So I liken that to, like, say you have had a bruise or a cut, right? A cut. And all of a sudden you see that after some time it's going to be a scab, right? Developing on that area, and anytime you remove that, it's going to start bleeding again. So that scab is similar to what happens in the mouth. In the mouth, you have to have that blood clot forming so that the process of healing can occur in a good manner, okay, or in a good way. So whenever the blood clot is actually dislodged, that's when you start having that area exposed. The socket, the bone in the socket is exposed. As I said earlier, the nerve endings are exposed, and you end up being in so much pain, and in fact the healing process becomes delayed. So you definitely don't want that to happen, right? You want to make sure that the healing process occur favorably so that you can heal, fast after an extraction. And definitely there are some things that can be done on your end so that you make sure that you avoid dry socket. In fact, there's still going to be cases where we don't really know it still happens, but there are definitely some things that you can do on your end to prevent from having a dry socket, and that's what we're going to address today. Okay, you definitely want to make sure that you follow the instructions that your dentist had provided you with. And sometimes, when you are having a tooth extracted, you're not even there. Some people get, they zone out because they don't really want to recall the experience, or they're in so much anxiety, so much stress or pain, fear, all of that, and so they don't really remember what happens. But usually we send them out with written instructions as far as what to do. And so it is, your responsibility as a patient to make sure that you follow the instructions. You can also make sure that you go, to your appointment with someone else that would give you a second set of ears, so that you know what to do afterwards, because there are definitely things that you might be doing that can cause you to end up having a dry socket. So now let's go into what you can do to avoid having dry socket. Number one, you want to avoid, if you're a smoker, you definitely want to avoid smoking. If you drink alcohol, you want to make sure that you stop drinking alcohol for at least next 72 hours. And for some people it's very hard, if they're a smoker, that comes their nerves and all of that, as they say, and you want to avoid that. Why? Because say when you're smoking, you're creating pressure, right? Negative pressure. And so that becomes like a vacuum that's going to suck out the clot that's trying to form. Because between that time, that particular day and around day 72 hours is when the blood clot is actually going to be more stable. And so once it's stable, it's going to stay there, right? But before then, it can be dislodged. So smoking or even drinking alcohol, what happens is that alcohol is a diuretic. So it's going to dehydrate that area, and so you have less water going into that area, further delaying the healing process. And even smoking or drinking, those chemicals can also affect that particular area. And even with alcohol, it's we provide you with some painkillers to make sure that you'll be comfortable during the healing process, where alcohol can actually interact with those medications, causing you to be in pain. So you definitely want to avoid doing those things. Okay, that's number one. Avoid smoking and drinking alcohol for the next 72 hours. When it comes to eating, you want to make sure that you avoid eating certain types of food. That's number two. You want to avoid spicy food because it can irritate the area. I always say, you want to avoid eating things that are so small, like rice, because it can get lodged in the area. You want to also avoid crunchy food because it can actually poke at the area, causing discomfort. So you want to make sure that all my all my African people, except for me, because I don't really like spicy food, my Mexican people who actually absolutely love spicy food, be mindful, okay? Because the spiciness of the food can actually irritate the area, causing pain. You want to avoid your Asian, African, you eat a lot of rice, try to avoid eating that during that time. Crunchy food, so you want to kind of like eat more like soft food. That's going to help you out a lot. Okay, another thing that you want to do is number three. You want to avoid drinking with a straw. And I know I've done many videos telling you that it's a good thing to drink with a straw, but during this time you want to forget about that and not drink with a straw, because just like smoking is going to cause that vacuum effect that can actually dislodge the blood clot, causing you and ending up causing you a dry socket. So for the first few hours, those few hours we talked about, 72 hours, try doing not doing that. Don't drink with a straw. That way we make sure that that clot is stable and you don't end up causing a dry socket for yourself. Okay, another thing you want to avoid, number four, you don't want to spit forcefully. There are many people, they come, we do the extractions, and after a while they just want to spit. They just want to spit. Try to avoid doing that forcefully. So you want to make sure, when for instance you're brushing your teeth, you can avoid that area for that particular day, but for the following days you can brush the other teeth, avoid that area, but definitely don't spit really roughly, because you can have the blood clot being dislodged. Okay, so you want to just let the water flow out, just be gentle. Okay, and that's going to help you. And number five, for those people who are athletic, or the people who work in places where they have to lift a lot of weight, you want to avoid strenuous exercise. Okay, so if you have had a tooth extracted, I know there's a patient of mine who is a gym instructor, and so after having a tooth extracted, we told the person, don't go and train the people, no Zumba classes, or maybe you can tell them what to do, but because what happens is that now when you exercise, you increase the blood flow in your body, and obviously the blood clot is actually the blood that is clotting in the area. So if you're going to be doing strenuous exercise, it's going to try to bleed out versus, clotting. And so we tell the people, say, for example, you're working in an area where you're lifting a lot of weight, try not to go to work, that particular day, be more at rest, and that's going to help you as far as this as decreasing the chance of getting dry socket. So that's what we wanted to discuss with you today. I'm trusting that this information was valuable to you. Make sure that you do the right thing to decrease the chance of getting a dry socket so that you can, after having lost a tooth, not ending up, 2 days, 3 days later on our chair with excruciating pain, hitting the dentist even further because you're in so much pain. There are definitely things that you can do, and that's what we wanted to discuss with you today. So that being said, if you're in an area where, we are located close to you and you don't have a dentist, because we don't want to steal you away from somebody else that can take great care of you, we are Healing Wings Dental. And we can help you. Okay, you don't have a dentist, or maybe you moving from one area to another, or maybe you want a second opinion, or maybe you don't know, you no longer feel like you're a good fit with wherever you're going. We can welcome you with open hands. We're here to help you. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas, and we are here just for you. You won't have to wait a long time to have an appointment. We can definitely see you in a timely manner and make sure that we become part of your journey with regaining good or hygiene or care or health, and also improving your smile if you feel like that's what is your concern. Okay, and our phone number is 972-213-0202, and we can be found on all our social media handles: YouTube, Facebook, Instagram, also on LinkedIn, on TikTok, and we have advice for you. If you have any questions, or if there's something that you needed clarification over what we talked about today, don't hesitate to drop a question. We'll make sure that we do answer them, and perhaps we can create a video for any further question that you may have that may not be related to the subject that we did discuss today. And yeah, please don't hesitate to subscribe to our channel, our YouTube channel, to befriend us, or follow us, like us, whichever, depending on whatever handle you are on. Okay, so again, that's Dr. Valerie Mukanga, and I wish you a fantastic day. Be blessed as always, and till we see you next time. Okay, bye. Have a great day.